Good afternoon, everybody. Today is March 11th, 2022. My name is Scott McGann with the Falmouth Health Department doing a COVID-19 update for the town of Falmouth. Our website is falmouthma.gov. I put the updated information from some of these slides on there, case count, so forth. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So one new thing is the CDC guidance is now recommending you wear a mask over your eyes when you're pumping gas to lower your risk of a heart attack. I had to say something funny for a change. So that's the new guidance. Wear it over your eyes while pumping gas so you don't have a heart attack. So getting on with it. COVID-19 cases, 4,081. These are PCR only. So obviously, as now that we've sort of transitioned to home tests, the accuracy of our case counts is iffy. But we can compare it among previous, and we've got 14 confirmed cases for the week, 7 probable. Those are rapid tests that you'd get at a place such as Convenient MD or so forth, so they're not home tests. Those don't get reported. Our 14-day incidence rate has dropped from 11.2 to 8.2, and our 14-day positivity is 2.86, down from 4.20. You see the case counts are down over the last 4 weeks. They've been well under 50. For PCR, which is good. Definitely the Omicron surge is waned. There is still cases out there, no doubt. There's some number a bit higher than that when you add into the home kits, so it's not like it's zero. There are still some cases out there. The curve has been flattened, so to speak. This is our flattening the curve. The flatter the line and the closer the dots are together, the better we're doing. And so, we've done, I've had a fairly good few weeks. I don't have anything new since the last time I did this. I get this from the county. I think the county numbers are similar. When we see incidence rates and positivity from the state, for Barnstable County, you'll see that, which also means I also get the number of hospitalizations from the county. I just don't have an update, so it's the old one. I apologize, but I don't have it. Case counts, I think last week was around 1,000 for this particular week for Thursday of last week. We're at 802. The 7-day average percent positivity is 1.60 for the state. The state had 22 deaths. The state is now recalculating how they do deaths, at least in our sort of world. I don't know what it's going to do for reporting, but they've done some stuff for our Maven system and so forth and listed what's considered a death, and they've gone back historically. And so I don't know what they're going to do as far as reporting that on their dashboard. Everything on our trends are downward. They remain downward, flattening on positivity because you're getting really low, you'll start flattening out. But everything's gone low and has remained in pretty good shape since probably similar numbers you would have seen in late summer, maybe early fall. Again, this was 7 on 2/28. I do not have anything new. If I did, I would post it. But I don't think that number is probably on the high side of what we're probably seeing. They're probably seeing. This chart comes out incidental and primary causes of COVID deaths, hospitalization, sorry. So the most recent one, March 9th, was 37% were in for primarily because of COVID, and of the 290, 63% were there, it tested positive incidental to why they were in the hospital, such as testing positive on a PCR test when you had COVID in January because you're there because you cut your finger, or, slicing bananas or something, or whatever reason you happen to be in the hospital for. I tried to pick something mild, things that are severe, but they have to believe they test everybody, and that's where that. So 37% of that case count of hospitalization March 9th, 37% were there because of the primary cause being COVID. Our incidence rate's slightly probably higher than all of Massachusetts was 11.5. We were lower at 8.2 for our incidence rate. That's the number of cases adjusted to 100,000 population on a daily basis. So Falmouth had a population of 8.2. A population of 100,000, it would be 8 daily cases. Since we have about a third of that, divide that number by 3, and that's our average daily cases. So that's kind of a couple of cases a day, 2 to 3 cases per day. So that's kind of we are compared to our peers is somewhere in the middle. The rest of the county. Positivity, maybe slightly a little higher than the average. We're definitely higher than state, and somewhere in the middle, so forth, of the rest of the county, as far as percent positivity. This chart, I always like to show this chart. This is the number of cases among vaccinated individuals. So far there's been 453,882 known cases of breakthrough. Those are those that have been vaccinated. 1.65% hospitalization. It's been around the 1.5, give or take, for a while now. And deaths have been around half of 1% at 2,484. So if you've been vaccinated, your hospitalization and your deaths are low. Among the entire population, about 8.6 of everybody who's been vaccinated have gotten COVID. Out of everybody who's been vaccinated in the state, way less, 0.14% have ever been hospitalized. So less people, not many people getting hospitalized. Very little percent of among vaccinated people get hospitalized. If they do, if they do get COVID, they have still a low risk of getting hospitalized. Our vaccination rates, again, still strong. I think there was 235 first, second, and booster doses over the past week, most of them being boosters. So we gained 57 first doses, 38 second doses, and 140 booster doses. 60.5% of fully vaccinated people have been boosted. So we have, again, good. You're not going to make big gains at this point because if you've wanted a vaccine, you've had plenty of opportunity over time to do so. Vaccine hasn't changed. Vaxfinder.mass.gov, pharmacies, Community MD, Community Health Center, Barnstable County Health Office, Community College. Check barnstablcounty.org. Well, you can check VaxFinder, and if they do stop doing some clinics, because things are slowing down a little bit, especially on the county level, state level, some of the mass testing sites have been closed to stop the spread. So check vaxfinder.mass.gov, okay, and that'll give you the most up-to-date of who's got some openings. If you're homebound, if you know somebody's homebound, you just call the health department, 508-495-7485. We'll put you in touch with the VNA, and we'll get somebody right out there. Pretty short order. As far as testing, pharmacies, the hospital, Community Health Center, Mashpee. The Cape Cod Church, which took over for Barnstable County Fairgrounds when the weather got cold, we're going to close that. No one's going there. And so that's going to be put down for a little while, put away for a little while. It's always going to be ramped back up. That's not that big. People are using home kits. Again, there's still a lot of convenient MD testing, still a lot of pharmacy testing, still can go through the hospital, and that's not changed. It's going to change anytime soon. Face coverings. Ooh, this got kind of screwed up a little bit. Sorry about that. Oop, go up. So this is the chronology of face coverings. So back on May 24th, 29th, so Governor Baker lifted it. And when the Governor Baker lifted the order for face coverings indoor, except for transportation, the Falmouth Board of Health and the Select Board voted to lift the mask order and adopted on the 25th, they adopted an advisory. On January 10th, the Select Board, with the Board of Health recommending, voted to have a mask requirement in town-owned properties. On February 28th, the Select Board voted to lift that. Okay. And then on February 15th, the school committee voted not to implement a mask mandate when they came back to school. So the mask mandate is not at the schools right now, nor is it a requirement in town buildings. And on its own, the Board of Health this past week voted to lift the advisory at this point. Having it as a tool, if things start to go sideways again, then they could always re-implement the advisory. But having an advisory when the case counts are real low, and we're kind of at the point that we're at with plenty of treatment, plenty of vaccine, the data showing that the hospitalizations aren't as high, and nor are the death rate. So that's what they've decided. The CDC is now looking at cases. Number of cases, so fewer than 200 or 200 or more per 100,000 in the past 7 days. You can either be high, low, or medium, and it's all going to be based on the percent staffed of inpatient beds, and the state will track that. I get my stuff from the county, that's why I just don't have it, but I still believe we're in the low category last time I checked. And so if we start moving to the higher rates, then we talk about more like mask mandates and things like that in schools and so forth. But right now, we're in low, and so this is right from the CDC. Low is personal preference. Medium is if you're immune compromised or high risk, you really should consider it. So it's a bit of an advisory for certain people that are more at risk. And then high, then they really want you to push sort of the mandates and the seriousness of it. So that's it for my recap. Our case counts levels since last fall, early summer, There's plenty of vaccine, plenty of testing capability. There are no mask mandates or advisories in town. Just consider your own circumstances and so forth. So that's what I have for an update. We'll just keep plugging away next week, I think. A couple more weeks, maybe I'll stop doing some of these if things stay the way they are. I guess the only other thing I would add is I haven't seen an increase in case counts since the mask advisories went out in school. I think I looked at that. I didn't see a number that blared out that we were seeing a lot of school-aged cases since the mask mandates. This is the second week since they came back from school, so good news on that. And I think that's all I've got for recap. And again, I'll see everybody next week. Thanks.